Hey everyone, this is Dr. Matt Sherwood again with Sherwood Spine and Sport. This next series of videos, we're going to be talking about the most common ailment that affects golfers. And you guessed it, it's low back pain. So my goal in this is to go through a couple of the most common causes of lower back pain as it relates to the golf swing. And then I want to go over some things that you can do at home to try to address those deficits and decrease your risk of having low back pain. So it's important to keep in mind that the golf swing is incredibly complex. This is just the tip of the iceberg here. So if you're trying some of this stuff and you're continuing to have problems, then you can seek out somebody that's TPI certified like myself or golf professional and go through a more comprehensive evaluation so figure out what exactly is causing that lower back pain. And I actually just wanted to start and go over some of the highest predictors of lower back pain. So the highest is a relatively low BMI. So meaning individuals that are tall and thin, which is surprising because I think lots of people think if you're overweight, you're more likely to have low back pain. But as it pertains to golf, that's actually not the case. So the tall, slender individual is more likely to have lower back pain. Interestingly, there's no correlation between hamstring tightness, hamstring length, and low back pain during golf. So that's also probably another common misconception. For a side bridge endurance test, so people that could hold a side bridge or a side plank, and they could hold it longer on the left side by about 12.5 seconds as compared to the right side, that was also a higher predictor of lower back pain, interestingly. And as I've spoken about in previous videos, they have found that golfers with lower back pain a lot of them seem to have limited internal rotation of the lead hip. So that also plays a role in lower back pain. So for this first video, we just spoke about a side bridge or a side plank. I'm actually just going to review the proper technique for that, make sure we're doing that properly. And that's already one thing that you can start incorporating into your strengthening program to help minimize your chance of low back pain, to try to normalize how long you can hold it on one side as compared to the other side. So we'll go over that now. All right, guys, so for a side plank or a side bridge, this is actually not incredibly complex here, but I'll just go over some things to make sure you're putting your body in a safe position, and then also some other little tricks if you want to try to increase the demand on the body here. So we want to make sure the feet are stacked. We're not bending our foot one way like this. They're just completely stacked on top of the other. This shoulder should be directly underneath the shoulder joint. So make sure it's not out here underneath. So we just want a nice centrated position of the shoulder there. And then what we're gonna do is we're gonna really squeeze the bottom of those obliques on the side here, because that's what we're working. So we're nice and straight. And then I also sometimes I like to push my bottom foot into the mat. And then I feel like that also gets a little bit more of that side glute activation as well. And then we're just holding that position. We want to make sure we're not too rotated, so we're straight up and down. And then we're gonna check and see, hold one side, kind of time it, see how long, switch, do the other side, and then see if you have a big discrepancy with times there. So your goal is essentially to kind of hold that to fatigue, and then you switch and do that the other side. And that's a real quick way. When you do that once a day, that's a couple minutes, so that's a real quick way to start getting your body in shape for golf and trying to minimize that risk of lower back pain.